CNA Practice Multiple Choice Test, 2026. Question 1. While the nurse aide is assisting a client to the commode, a visitor enters the room. How should the nurse aide respond? A. Can't you knock? B. Hi. This will only take a moment, so please take a seat. C. Would you help me lift the client? D. Would you please wait in the lobby? The correct answer is would you please wait in the lobby. Privacy and dignity are paramount. Visitors should be politely asked to wait outside during private care activities. Question 2. The nurse aide should perform oral care on a client who is unconscious at least every A. 2 hours, B. 3 hours, C. 4 hours, D. 5 hours. The correct answer is 2 hours. Unconscious clients cannot swallow or produce saliva effectively, increasing the risk of dryness and infection. Frequent oral care, every 2 hours, is standard. Question 3. The nurse aide should report a client's concerns directly to the A. nurse supervisor, B. primary health care provider, C. client's family, D. to administrator. The correct answer is nurse supervisor. The nurse supervisor is the direct line of authority for the CNA and coordinates the care plan. Question 4. Before assisting a client into a bath or shower, the nurse aide should first A. check the temperature of the water, B. shampoo the client's hair, C. soak the client's feet, D. apply lotion or oil to the client's skin. The correct answer is check the temperature of the water. Safety is the priority. Verifying water temperature prevents burns. Question 5. A client looks forward to playing cards each morning. The nurse aide should A. tell the client that the nurse aide is too busy today to take the client to play cards, B. plan the client's schedule so that the client is bathed and dressed in time for playing cards, C. tell the client that the nurse aide forgot that the client wanted to play cards, D. ask the client to bathe and dress self before taking the client to play cards. The correct answer is plan the client's schedule so that the client is bathed and dressed in time for playing cards. Accommodating the client's preferences and activities promotes quality of life and independence. Question 6. A client with Alzheimer's disease wanders from room to room while moving the belongings of other clients to different locations. Alert and oriented clients are angry that their things have been moved. The nurse aide should A. return the client to the client's room and close the door, B. find the missing articles and return them, C. walk with the client at all times to keep the client from wandering, D. tell the other clients to be understanding of the client's condition. The correct answer is find the missing articles and return them. The aide should resolve the conflict by returning the items and addressing the behavior without isolating the client. Question 7. A client is paralyzed on the left side. The nurse aide should place the signaling device A. on the client's right hand, B. on the left side of the client's bed, C. on the chair at the left of the client's bed, D. on the table at the foot of the bed. The correct answer is on the client's right hand. The signaling device must be placed on the client's strong, unaffected side so they can use it. Question 8. Physical restraints are used most often, A. to prevent client injury, B. when the nurse aide staff is unavailable, C. at the family's request, D. to prevent clients from wandering. The correct answer is to prevent client injury. Restraints are a last resort used strictly to prevent the client from harming themselves or others. Question 9. What is the first thing a nurse aide should do when finding an unresponsive client? A. Place a cold washcloth on the client's forehead, B. call for help, C. close the door to provide privacy to the client, D. call the client's family. The correct answer is call for help. In an emergency, activating the response system, calling for help, is the immediate priority. Question 10. What type of fire can be put out with water? A. Electrical. B. Grease. C. Paper. D. Chemical. The correct answer is paper. Class A fires, paper, wood, cloth, can be extinguished with water. Water is dangerous for grease or electrical fires. Question 11. When caring for a client from another country, the nurse aide should A. Be sensitive to the client's cultural needs, B. Orient the client to the cultural practices of the facility, C. Promote participation by the client in group activity, D. Explain to the client that cultural preferences are not important when providing care. The correct answer is be sensitive to the client's cultural needs. Cultural competence involves respecting and accommodating individual cultural beliefs and practices. Question 12. If a client has hand tremors, the nurse aide should A. Restrain the hand that has the tremor, B. Assist the client with activities of daily living, ADL, as needed, C. Tell the client to stop shaking and control the tremors, D. Do everything for the client. The correct answer is assist the client with activities of daily living, ADL, as needed. The goal is to support independence while providing necessary assistance for tasks the client cannot perform alone. Question 13. When taking a client's radial pulse, the nurse aide should A. Count 2 pulsations as 1 pulse beat, B. Place the nurse aide's fingertips on the client's wrist, C. Place the nurse aide's fingertips on the side of the client's neck, D. Count for 5 full minutes. The correct answer is place the nurse aide's fingertips on the client's wrist. The radial pulse is palpated at the wrist using the fingertips. Question 14. The female perineum should be cleansed A. From front to back, B. Without soap, C. With oxygen peroxide, D. From back to front. The correct answer is from front to back. Cleansing front to back, urethra to rectum, prevents introducing fecal bacteria into the urinary tract. Question 15. To lift an object by using good body mechanics, the nurse aide should A. Keep both feet close together, B. Lift with abdominal muscles, C. Bend the knees and keep the back straight, D. Hold the object away from the body. The correct answer is bend the knees and keep the back straight. Bending at the knees uses the strong leg muscles for lifting, protecting the back. Question 16. The nurse aide is caring for a client who has dentures. Which of the following actions should the nurse aide take when caring for the client's dentures? A. Store the dentures in the client's bathroom on the sink. B. Clean the dentures with regular toothpaste. C. Use hot water to disinfect the dentures. D. Line the bathroom sink with a towel before cleaning the dentures. The correct answer is line the bathroom sink with a towel before cleaning the dentures. Lining the sink prevents the dentures from breaking if they are accidentally dropped. Question 17. Right before dinner, a client is incontinent of urine. The nurse aide should A. Minimize the interruption of the client's dinner by cleaning up the client after dinner, B. Clean the client and take the client to dinner as soon as possible, C. Tell the client not to eat until the client has cleaned and changed self, D. Insist that the client eat dinner in the client's room. The correct answer is clean the client and take the client to dinner as soon as possible. Hygiene and dignity require immediate cleaning, followed by facilitating the meal. Question 18. When operating a manual bed, the nurse aide should remember to A. Elevate the client's head at all times, B. Lock the wheels only when the cranks are folded, C. Fold the cranks under the bed, D. Raise all the side rails. The correct answer is fold the cranks under the bed. Folding the cranks prevents staff and visitors from tripping or injuring themselves on protruding handles. Question 19. The nurse aide is providing care for a client after elimination. It would be most important for the nurse aide to A. Keep the client comfortable, B. Prevent soiling the bed linen, C. Ensure that all feces are removed from the client's skin, D. Use soap and water when cleaning the client to keep the linen costs down. The correct answer is ensure that all feces are removed from the client's skin. Skin integrity is crucial. Fecal matter can cause rapid skin breakdown and infection. Question 20. The nursing care plan states, transfer with mechanical lift. However, a client is very agitated. To transfer the client, the nurse aide should A. Lift the client by placing the nurse aide's hands under the client's underarms. B. Place the client in the lift. C. Get assistance to move the client. D. Keep the wheels unlocked so that the lift can move with the client. The correct answer is get assistance to move the client. Safety first, an agitated client in a mechanical lift is dangerous. Assistance helps manage the behavior and ensure safety. Question 21. For safety, when leaving a client alone in a room, the nurse aide should A. Raise all the side rails. B. Place a signaling device within the client's reach. C. Apply a restraint to the client. D. Leave the bed elevated in the highest position. The correct answer is place a signaling device within the client's reach. The call light, signaling device, is the client's lifeline to help. It must always be accessible. Question 22. The nurse aide sees a client spill water on the floor in the hall. Another client is walking down the hall. The nurse aide should A. Call the nurse. B. Clean up the spill. C. Task another nurse aide to clean the spill. D. Leave the spill. The correct answer is clean up the spill. Immediate action is required to prevent a fall hazard, safety priority. Question 23. The nurse aide is walking with a client who uses a wheelchair when the facility fire alarm system is activated. The client becomes excited by the noise. The nurse aide should A. Carry the client out of the facility. B. Leave the client to search for help. C. Comfort the client while moving to a safe place. D. Lock the client's wheelchair and check the surrounding area for smoke. The correct answer is comfort the client while moving to a safe place. The priority is to evacuate safely, race protocol, while managing the client's anxiety. Question 24. The nurse aide is going to help a client walk from the bed to a chair. What should the nurse aide put on the client's feet? A. Socks or stockings only. B. A cloth-soled slippers. C. Rubber-soled slippers or shoes. D. Nothing. The correct answer is rubber-soled slippers or shoes. Non-skid footwear is essential to prevent slips and falls. Question 25. The nurse aide should refuse to perform a task if the A. nurse aide has not been trained to do it. B. Client is difficult to deal with. C. The nurse aide is too busy. D. Nurse aide is at the end of the shift. The correct answer is nurse aide has not been trained to do it. Performing tasks outside of one's training or scope of practice is unsafe and unethical. Question 26. When assisting a client in resolving grievances, the nurse aide should report the grievance to the A. Primary healthcare provider. B. Family. C. To administrator. D. Nurse in charge. The correct answer is nurse in charge. The nurse in charge is the first point of contact for resolving facility-related grievances. Question 27. The nurse aide should place soiled linen A. in the linen closet, B. on the chair, C. in the dirty linen container, D. on the overbed table. The correct answer is in the dirty linen container. Infection control requires placing dirty linen directly into the designated receptacle. Question 28. The nurse aide is reviewing fire prevention measures. Which of the following, if performed by the nurse aide, would require follow-up? A. Taking all cigarettes and matches away from clients and visitors. B. Being aware of the locations of fire extinguishers. C. Reporting all damaged wiring and slasher sockets in clients' rooms. D. Participating in fire drills. The correct answer is taking all cigarettes and matches away from clients and visitors. Confiscating personal property violates rights. Instead, enforce safe smoking policies/areas. Question 29. When giving care for a client, the nurse aide should avoid unnecessary exposure of the client in order to protect the client's right to A. Privacy, B. Confidentiality, C. Personal choice, D. Personal hygiene. The correct answer is privacy. Privacy includes not exposing the client's body more than necessary during care. Question 30. When taking an oral temperature, it is important to A. Place the thermometer in hot water to test the thermometer, B. Insert the thermometer under the arm, C. Position the thermometer under the tongue, D. Put lubricant on the thermometer. The correct answer is position the thermometer under the tongue. Oral thermometers must be placed in the sublingual pocket, under the tongue, for an accurate reading. Question 31. When caring for a client who uses a protective device, restraint, the nurse aide should A. Assess the client once during every hour, B. Assure that the protective device is tight, C. Check the client's body alignment, D. Release the protective device once during every shift. The correct answer is check the client's body alignment. Proper body alignment prevents injury. Note, restraints should be checked more frequently than every hour, typically every 15 minutes. Question 32. The nurse aide is assisting a client to transfer from the bed to the wheelchair. Which of the following actions should the nurse aide take? A. Place the bed in the low position. B. Place a pillow on the wheelchair seat. C. Lower both footrest pedals. D. Release the wheel brakes. The correct answer is place the bed in the low position. Lowering the bed allows the client's feet to touch the floor, providing stability for the transfer. Question 33. When communicating with a client's family, the nurse aide should A. Listen to concerns and offer support, B. Offer advice about the client's medical treatment, C. Get involved in family problems, D. Inform the family of any changes in the client's condition. The correct answer is listen to concerns and offer support. Listening is supportive and within scope. Medical advice and updates are the nurse's responsibility. Question 34. When performing oral care, in what position should the nurse aide place a client who is unconscious? A. Supine, B. Lateral, C. Prone, D. A Trendelenburg. The correct answer is lateral. The lateral, side-lying, position prevents aspiration of fluids into the lungs. Question 35. The nurse aide notices that a client's bedside lamp cord is draped across a chair in order to reach the nearest outlet. The nurse aide should A. Tell the client that the bedside lamp is a safety hazard and take it away, B. Unplug the bedside lamp and ask the client not to use it, C. See if any changes can be made so that the bedside lamp can be plugged in safely, D. Ask the client to avoid walking by the bedside lamp. The correct answer is see if any changes can be made so that the bedside lamp can be plugged in safely. Resolving the safety hazard while maintaining the client's convenience is the proactive approach. Question 36. The nurse aide can provide a client with a sense of security by A. Performing all activities of daily living, ADL, for the client, B. Leaving the room without speaking, C. Explaining all routines and procedures, D. Talking to another nurse aide while providing care. The correct answer is explaining all routines and procedures. Knowing what to expect reduces anxiety and builds trust. Question 37. A client who is confused and disoriented is asking to go home. The nurse aide's best action would be to A. Tell the client, this is your home, B. Take the client to the activity room, C. Ask the client to tell the nurse aide about the client's home, D. Tell the client, we will take you home later. The correct answer is ask the client to tell the nurse aide about the client's home. Validating the client's feelings and engaging in reminiscence therapy, asking about home, is comforting. Question 38. A client tells the nurse aide that oral care was last performed 2 days ago. The nurse aide should report this finding to the A. client's family, B. nurse in charge, C. director of nursing, D. administrator. The correct answer is nurse in charge. This indicates a potential gap in care or neglect that the immediate supervisor, nurse, must address. Question 39. Pressure ulcers can be prevented by A. placing an incontinence brief on the client, B. positioning a pillow under the client's head, C. addressing the client in loosely fitting clothing, D. repositioning the client every 2 hours. The correct answer is repositioning the client every 2 hours. Frequent repositioning relieves pressure on bony prominences, preventing skin breakdown. Question 40. The electric shaver that the nurse aide is using to shave a client begins to spark and smoke. What should the nurse aide do next? A. Call the nurse in charge. B. Finish shaving the client as quickly as possible. C. Use the roommate's shaver to finish the shave. D. Unplug the shaver. The correct answer is unplug the shaver. Immediate safety action: remove the power source to prevent fire or shock. Question 41. When giving a back rub, the nurse aide should A. use a circular motion, B. position the client in the supine position, C. use short, light strokes, D. warm the lotion in the microwave. The correct answer is use a circular motion. Long, circular strokes are relaxing and therapeutic. Microwaving lotion risks burns. Question 42. If an alert and oriented client touches a nurse aide inappropriately, the nurse aide's best response is to A. slap the client's hand, B. step back and ask the client not to do it again, C. refuse to care for the client, D. warn the client that the behavior may be punished. The correct answer is step back and ask the client not to do it again. Setting clear, professional boundaries is the correct response to inappropriate behavior. Question 43. While making an empty bed, the nurse aide sees that a side rail is broken. The nurse aide should A. wait for the next safety check to report the broken side rail, B. report the broken side rail immediately, C. tie the side rail in the raised position until it is fixed, D. warn the client to be careful when the client gets back into bed. The correct answer is report the broken side rail immediately. Broken equipment is a safety hazard and must be reported/tagged for repair immediately. Question 44. What should the nurse aide do first when changing an ostomy bag? A. Put on gloves. B. Wash hands. C. Explain the procedure to the client. D. Wash the area around the stomach. The correct answer is explain the procedure to the client. Always explain the procedure first to gain consent and reduce anxiety. Question 45. Which of the following statements might strongly indicate that a client is considering suicide? A. I think I need to see a psychiatrist. B. I want to go to sleep and never wake up. C. I woke up feeling sad today. D. I miss my family. The correct answer is I want to go to sleep and never wake up. Statements about never waking up or wanting it to end are red flags for suicidal ideation. Question 46. The nurse aide should understand that an example of an alternative to restraints is A. lap buddy/tray, B. sedative, C. bed alarm, D. a hand mitt. The correct answer is bed alarm. Bed alarms alert staff to movement without restricting the client's freedom, unlike the other options. Question 47. The best razor to use when shaving a diabetic client is A. a safety razor, B. an electric razor, C. a disposable razor, D. a straight edge razor. The correct answer is an electric razor. Electric razors minimize the risk of nicks and cuts, which are dangerous for diabetics due to poor healing. Question 48. The client's Bill of Rights includes A. Free medical care, B. A freedom of choice, C. Access to the medicine cart, D. Access to the laundry. The correct answer is freedom of choice. Clients have the right to make choices about their care, schedule, and life. Question 49. When a hearing aid is not being used by a client, it should A. Be given to the client's family, B. Be left turned on, C. Have the battery removed, D. Be stored in alcohol. The correct answer is have the battery removed. Removing the battery prevents corrosion and saves battery life. Question 50. The nurse aide gave a client the wrong diet. Which of the following actions should the nurse aide take? A. Report the error to the nurse. B. Ignore the error. C. Remove any evidence of the error. D. Blame another nurse aide for the error. The correct answer is report the error to the nurse. Reporting errors immediately allows for corrective action and ensures client safety. Question 51. A client has informed the nurse aide that the client's religious beliefs prohibit eating certain food items. The nurse aide should report this information to the A. Dietitian, B. To administrator, C. Charge nurse, D. Client's family. The correct answer is charge nurse. The charge nurse coordinates dietary orders and ensures the care plan respects religious needs. Question 52. Incident reports are written in order to A. Inform the primary health care provider, B. Notify family members, C. Identify who is at fault, D. Record details of unusual events. The correct answer is record details of unusual events. Incident reports provide a factual record of unexpected events for quality improvement and legal purposes. Question 53. While eating dinner, a client starts to choke. The nurse aide should A. Immediately remove the client's food tray and go to find the nurse in charge, B. Slap the client on the back until the food dislodges, C. Call for assistance and perform the Heimlich maneuver, abdominal thrust, D. Give the client a drink of water. The correct answer is call for assistance and perform the Heimlich maneuver, abdominal thrust. Immediate intervention with the Heimlich maneuver is required for a blocked airway. Question 54. A client's family member asks the nurse aide what medication the client is receiving. The nurse aide should A. Allow the family member to review the client's medication list, B. Tell the family member the medications that the client is taking, C. Refer the family member to the nurse, D. Give the family member the client's chart. The correct answer is refer the family member to the nurse. Discussing medications is outside the CNA scope of practice, refer to the nurse. Question 55. When transferring a client to a different unit, the most important information the nurse aide needs is the A. Phone number to the client's room, B. Client's medical diagnosis, C. Name of the client's spouse, D. Name and room number. The correct answer is name and room number. Ensuring you have the correct client, name, and destination, room number, is critical for transfer. Question 56. What is the main purpose of continuing education for the nurse aide? A. Client safety, B. Review of skills, C. A facility compliance, D. Promotes teamwork. The correct answer is client safety. Keeping skills and knowledge up to date primarily ensures the safety and quality of care for clients. Question 57. A button hook and a sock assist are all part of what type of health care? A. Restorative, B. Preventive, C. Protective, D. Alternative. The correct answer is restorative. Restorative care uses adaptive devices to help clients maintain independence. Question 58. The nurse aide is caring for a client who answers every question by nodding and saying yes. Which of the following actions should the nurse take? A. Inform the nurse of the client's behavior. B. Ask a family member to translate for the client. C. Speak to the client while using medical terms. D. Increase voice volume when speaking to the client. The correct answer is inform the nurse of the client's behavior. This behavior may indicate a lack of understanding or a neurological issue. The nurse should assess communication needs. Question 59. What should the nurse aide do to communicate with a client who speaks and understands only another language? A. Use gestures. B. Speak more slowly. C. Listen and say nothing. D. Use the services of an interpreter. The correct answer is use the services of an interpreter. Professional interpretation is the only way to ensure accurate communication. Question 60. When ambulating a client who has an unsteady gait, it is best for the nurse aide to use A. Single crutch. B. Gait belt. C. Quad cane. D. Wheelchair. The correct answer is gait belt. A gait belt provides a secure hold to support the client and prevent falls.